So hello everyone, welcome to our channel. So today's lecture we are going to discuss about general anesthesia. Okay, so this is the important chapter in a D plus B pharmacy syllabus. So these are the main important drug of a general anesthetics, that is a cyclopropane, halothane, then diethyl ether, methohexatone sodium, that is thiopical sodium, and tricyclophosodium. These are the 6 drugs are used in a general anesthetic as a general anesthesia. First one, you want to know what is the meaning of general anesthesia. In the last lecture we are already discussed as a local anesthetics. Local anesthetics means these are the used in a only local area, that means main part used as a anesthesia, but general anesthesia are used in a whole body, that is the loss of consciousness. Okay, so general anesthetics drugs are also used in a surgery, that is the classification of general anesthesia. And then this is the tree diagram of a general anesthetics. Okay, so it is important for the uh, chemistry, that is the 4 marks. Already we are already discussed in that syllabus question paper on a anesthetics drug. So let's begin today's lecture now. Definition and classification of a general anesthesia. So first one, what is the introduction or definition of anesthesia? So general anesthesia are the CNS depressant drug. Okay, so obviously it is also used as a central nervous system depressant drug, that means which produce a partial or total loss of sense of a pain accompanied by a loss of consciousness. That means it used as a central nervous system drug that will produce partial or total loss of sense or loss of consciousness. Okay, so this is called as a general anesthetics. Then second point is general anesthetics are used to produce anesthesia before surgical operation or obstetrics. Then general anesthesia is a state produced when a patient receives medication for amnesia. It is a specific type of a disease as in a analgesia, muscles relaxation and sedation. So the next point is this is the basic definition, 2 marks के लिए definition आता है आपको. So what is general anesthesia? The next point, general anesthesia are the drug which produce the reversible loss of all the modalities of a sensation and consciousness, or simply a drug that bring about the reversible loss of consciousness. Now the general anesthetics are classified in depending on their mode of administration. Mode of administration means that anesthetic drugs how to administrate. So first one is a inhalation anesthetic, means nasal route, and then second one is a intravenous IV route. Okay, so this is this 2 types of general anesthesia depending on the mode of administration. नाउ क्लासिफिकेशन, इनहेलेशन एनेस्थेटिक्स में कौन से ड्रग आते हैं? फर्स्ट वन गैस, दैट इज अ नाइट्रस ऑक्साइड आर यूज्ड एज अ इनहेलेशन एनेस्थेटिक, मीन्स यूज एडमिनिस्ट्रेटेड इन अ nasal route, through the nasal route. The next one, volatile liquids, ether, halothane, enfluran, isofluran, desfluran and sevofluran. Okay, and last one is a chloroform. So these drugs are used in a inhalation anesthetics, that means nasal route से ये drug use करते हैं, that means the inhalation anesthetics. Now next one is a intravenous anesthetics that are also used in a IV route, administered through the IV route. So first one is a thiopentone, is an important drug. Then methohexatone sodium, propofol, etomidate and benzodiazepines. Benzodiazepine are already discussed, that is the slow acting agent, important diazepam, lorazepam and midazolam. So these are the benzodiazepines are used as a anesthetics, that is the general anesthetics drugs used through the IV route. So this is the basic and important tree diagram of a general anesthesia: inhalation and intravenous. So gas is the nitrous oxide, then volatile liquids are halothane, enfluran, isofluran, desfluran, cyfluran and methoxyfluran. Now second one is a intravenous, is a slower acting and inducing agent. Slower acting are dissociative anesthesia, that is a ketamine, important drug. Then opioid is a fentanyl, and benzodiazepine is a slower acting compound, that is a diazepam, lorazepam and midazolam. Then next one is a inducing agent, is a thiopentone, methotrexate, propofol, etomidate and dexmedetomidine. So these are the tree diagram and important general anesthetics drugs. It is important question for the 4 marks. Okay. So this is the main classification of general anesthetics drugs. Now coming towards the one by one, chemical structure, chemical name and uses of anesthetics. So this is the halothane, then uses, advantages, official preparation, structures. This is the cyclopropane, structure, properties, uses. Then diethyl ether, anesthetics ether, chemical properties, uses, official preparation plus structure. Methotrexate sodium is also important drug used as a general anesthesia. Then thiopentone sodium is also important drug. And last one is a trichloroethyl ethylene. So this is the structure, physical properties, uses and brand name. So finish. So all that other drugs we are discuss in a next lecture. So thank you.